There is no mapping of who's going to become addicted.
The devastating reality is that addiction knows no boundaries. It doesn't discriminate by age, background, or circumstance.
I remember being a kid just not really feeling like I fit in. Like, I don't know that I was ever really happy. I think from the very first time I ever tried alcohol, I was addicted. Like, that was the thing I needed. And then after that, it was, what else can make me feel this good? You know, I missed birthdays, Christmases, Easters, all of the celebrations. I missed births, I missed deaths. Just really thinking about the time that I missed. I never intended to do that. That was never my intention.
For many, addiction took root early, shaping the course of their lives in ways they never imagined. But their stories don't end here. That's where Rimrock steps in.
Rimrock has served over 12,000 unique individuals since 2020. So in about 49 months, we see about 250 new individuals a month, whether it's our inpatient or outpatient, at some level. And it's significant. And what we're doing and what we really want to do is heal the communities.
It's very easy to find drugs on the street, in our communities, even in our school parking lots. So with more people trying drugs, experimenting with drugs, with more people, cartel members, gang members coming here into community, flooding our streets with drugs, we need facilities like Rimrock to be here to combat the problem.
We have to be open to what's out there. This isn't your grandma and grandpa's addiction treatment center. It's not your grandma and grandpa's type of drugs that are out there anymore. It's not your Cheech and Chong, it's marijuana. Like, the stuff that's out there today is harsh, it's heavy.
It's changed so drastically, not just the different types of substances, but they've become more toxic. The methamphetamine is more toxic, the opiates are more toxic. And so it's not just the number of substances, it's also the strength of them, and that we very rarely have people who just do one. They're usually doing several.
I think our approach is really individualistic. You know, how can you rebuild a social structure that is sober?
Addiction is a disease of the brain. There are physical changes that happen in the brain when a person has an addiction.
A depression, anxiety are a trigger, right? And so if we don't address that simultaneously, then the patient's not really stabilized when they discharge.
Addiction impacts all different types of families, and it doesn't make that family bad if addiction occurs within their household.
Rimrock isn't just a treatment center, it's a beacon of hope. By blending cutting-edge medical care with compassion, Rimrock creates pathways to recovery, healing individuals, and uniting families. But it can only continue with the community's help.
Rimrock gave me my life back, gave me a chance to be an active member of my family. I remember I didn't ever mean to hurt the people the way that I did, but I did all the things, and I did them. I actively chose to do all of them.
Together, we can ensure that hope and healing are always within reach.
One of the biggest challenges that Rimrock faces is being able to provide care to everyone that needs treatment. We are the leading providers of mental health and addiction treatment in the state, and we're just here in Billings. If we could spread our reach to other communities, I think that the impact that we could have on our state and our region would be enormous.
Rimrock's vision stretches beyond Billings, beyond today, to a future where recovery is accessible to everyone in need. With your support, Rimrock can reach more individuals and ensure lasting recovery for generations to come. Because Rimrock is recovery.